I think the first thing you're struck by when you come to the Depression Recovery Residential Program is the beautiful scenery we have. And when you get here, you'll meet with your team. And once you get settled in, you start to get into the rhythm of kind of what we do. While we focus on depression, yes, we also provide services for anxiety and conditions like borderline personality disorder. We are focused very much on behavioral activation, getting up and doing something instead of ruminating about what's bothering you, actually getting up and moving and changing the way you feel by changing what you do. These type of behavioral therapies are at the core of what we do, and we feel they're extremely important for helping people recover. All of our programs provide excellent nurse practitioners, doctors, and our medical team. You'll meet with a psychiatrist to help you in terms of medications, and that's an important part of recovery and a big part of why people come here.
Everyone here is helping and wanting to get you to a place where you feel like you can function in the world, and just kind of letting people know like it's okay to do these kind of things and take the time for yourself to better your mental health. You have someone there to help you and support you at all times. And then also you're around other people that are also going through stuff that you're going through. It's really beneficial. It's nice to kind of be able to relate to people and talk to people about stuff.
One of the things that we try to do is meet them where they're at and really try to identify, what are their goals for treatment. We really encourage people to include their family members, their loved ones, their spouses. Their loved ones kind of often have questions about, well, if this comes up, what do I do? How do I handle this? So we really try to work with them to share strategies that they're learning here.
Roger specializes in evidence-based medicine and care. And we also want things that are measurable. So then we can look at the data and see the progress. Or if we're not seeing the progress, we can make adjustments to what we do to try and help achieve that progress. There's intentionality into almost everything we do. There's art therapy. One of the coolest things we do is our ropes course, where you can go climb on this ropes course and overcome some fears and establish trust, and it becomes metaphorical for other things that you might do. And so you take this one little accomplishment that you can get here, and that can translate to more accomplishments and give you the confidence you need to move forward in your life.
And what's really cool is that it's not necessarily just about the paper mache that we're building. It's about working through the emotions that are happening in the moment and then seeing that it doesn't have to be debilitating. We can work through it.
I think a lot of times people come here having already tried a bunch of different treatments and gone to different places, and they didn't really get what they were looking for. By the end of their treatment, we can see them walking out the door with a smile on their face, and they feel like they've progressed way better than they thought they could have. They're in a way better spot than when they came in, and they feel like they're ready to take on the world. It's just nice to know that the things that we do here are effective, and people are able to leave here in a way better spot than when they came in.